Hey, it's Dr. Sebastian Gonzales again. Today we're going to discuss Piriformis Syndrome, how it can correlate to your running, how you can improve it, and just knowing that you have it in the first place. Piriformis Syndrome is a condition that mainly can affect the hip, but also peripherally down the leg, and it can have the same type of presentation as sciatica or a lumbosacral type of neuropathy. So what we're looking for is mainly pain at the top part inside the buttocks area. It can feel like a rail, and if you look at the anatomy, if you go onto Google and search piriformis and look at the anatomy of it, you'll see that it runs at about a 45-degree angle from the sacrum to the trochanter of the hip. And what you'd want to figure out is which muscle is really the problem down there, because there's a couple different rotators which can create some issues down there. Piriformis is the most common one. However, it's important to know which one specifically is the problem to get the right type of treatment for you. Piriformis syndrome can create nerve pain down the leg. It usually goes posteriorly down the back of the thigh. When it gets to the knee right here, it basically can split into two. There's the tibial nerve, which goes straight down here and it can innervate the bottom of the foot. Also, there is the common peroneal nerve, which goes this direction, which can innervate the side of the leg right here. What it is important to realize is if you neglect it, it's only going to get worse. A lot of these types of problems are called cumulative trauma disorders because they build up from a buildup of either training or poor mechanics or whatever, but it causes lots of these little tears that occur, makes the tissue become more or less elastic, which ends up having more of these little tears, which occur eventually will develop into a bigger problem. Go find someone in your area who can address Piriformis syndrome for you. A lot of people choose to use foam rollers and tennis balls and trigger point balls and so on. I think those are all really great options, but at the same time, when your condition is far enough along, you really want to make sure that you have someone specific to get in there and then know exactly what they're doing with it. A couple different treatment options I've run across is active release technique, or ART. Graston technique seems to work okay as well. But at the same time, these things really just take care of symptoms. I feel that they are very good at removing scar tissue, which is a critical thing that you have to do with this condition. Yet, when you think about how this usually went, is a lot of times people have had it for a while. So also there's a certain amount of atrophy and lack of strength within that muscle, which really needs to be addressed before actually you can find complete resolution. What I usually recommend is doing a course of some type of myofascial release, which is going to break down that scar tissue and make you feel better within a certain time period. After that, I really recommend a lot of people do strengthening types of stuff. Eccentric loading the muscles has been really good for different types of conditions out there. However, it hasn't been really tested for Piriformis syndrome. I've used it on a couple people in my office with it, and they've responded perfectly fine with it. So eccentric loading seems like it's a pretty safe way to go in this regard, at least in my opinion.
Don't forget to check out our ebook at the website below.